What are Medicare networks, and does anybody really understand these things? Apparently not. So, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute, and we are going to look at networks in Medicare. My wife is about to retire, and she is leaving the group insurance plan. We'll be leaving the group insurance plan this end of this month, and is in the process of enrolling in Medicare. And this has been a tough decision for her in many ways. And, I've been trying to prepare her for this moment, both the retirement part and the Medicare part. And some days it feels like, I'm just not getting through to her. And especially both of them, about the retirement part and the Medicare situation. I've been telling her for years, you need to retire. You don't need to continue working. And until her brother told her a few weeks ago, you really ought to retire and enjoy life, she didn't do anything. So it probably was exaggerated a little bit, or at least it was stepped up. Her retirement plans were stepped up a little bit because of this COVID thing. She works in a school system, so it was probably speeded up just a bit, and that's okay with me. The Medicare part, I thought we pretty much had it down pat, because I've been trying to tell her she is, let's just say she's over 65, and she's been resistant to give up her group insurance plan, even though I told her, when you turn 65, you really ought to get off the group and go on this. This would be better off. But no, she didn't want to do that. So, you don't push it. All right, so now that she's retiring, she doesn't have a choice. She does, but she doesn't. The school system she works for has a retiree program. It is a self-funded Medicare Advantage program. And I've told her, I said, there's a lot of issues there that you need to be aware of, not the least of which is that it is a self-funded plan. The good news is that they can be a little more liberal in the benefits than a traditional Medicare Advantage plan. The bad news is that, funding isn't always guaranteed, and although it is a government system, government systems, at least at the local level, federal is a completely different story. I'm not even going to get into that. But government programs, at least at the local level, can go in and get into financial problems, and benefits can be reduced. In some cases, they can even be eliminated. There are some municipalities that have, it's basically, they've had to go bankrupt in order to get out of their pension obligations. And that's a whole nother story there too. But in any event, the Medicare program that's offered through her soon-to-be former employer is a Medicare Advantage plan. Of course, she's talked to a lot of her friends and so forth, and one in particular has had numerous medical issues. I don't know about before retirement, but since retiring and going on the retiree Medicare Advantage plan. I don't know, but she's had a lot since then. Back surgery, she's had, I don't even know them all. But Rachel does. she keeps me updated on them, even though I don't even know this lady. But she seems like a really nice lady, just somebody who's had kind of a rough life as far as her health is concerned. And recently, she was talking to her. Rachel was talking to this lady who is retired and is right now recovering from her, I believe it's her third spinal surgery within the last 3 months maybe. something like that. And she's had a lot of pain. She's now at a point that she still has pain, but it's not as great as it was. And but she's had, like I said, several spinal surgeries. And so Rachel was asking her, well, what about your care? And don't you have a problem with networks? Because again, it's a managed care plan. It's a Medicare Advantage plan, which by definition is managed care. That means you've got networks. You can go here, you can't go there, and so forth. And the lady said, "Oh, I don't have any networks." And she says, "Really?" She said, "No, no, no. I can go anywhere my plan tells me to go." Yeah, and I pretty much rolled my eyes like that when I'm talking to Rachel. I'm not talking to this lady, but if we were discussing this over the phone, she would be seeing my eyes roll when she says, "Well, I can go anywhere my plan tells my insurance company tells me I can." Honey, that means that you have networks. You can't go just anywhere. Well, you can, but it's going to cost you a lot more if you go somewhere else. And so let's talk about this. It occurs to me, and most people have been covered under some kind of health insurance plan for a number of years by the time they get to 65. And just about every plan that I know of for the last probably 30 years, 25, 30 years, has been some kind of managed care. It means PPO or HMO. There's a few other variations, but those are the two primary ones. And there are rules. And you can go here, you can't go there. Well, yeah, you can go there if you want to, but you're going to have to pay the bill for it, because we may not pay it. And there's also the issue of balance billing and some other stuff. So it occurred to me, maybe when I'm talking to folks about networks, maybe I'm not quite painting a visual image to help them understand. Let's say that you go into a restaurant about 4 o'clock in the afternoon. You missed lunch, and you're getting kind of hungry, but you don't want to wait until it's supper time, so you're going to go to the restaurant at 4 o'clock. And so you sit down at the table, and the waiter says, "Would you like to see the lunch menu or the dinner menu?" And it's like, wow, I hadn't thought about that. Okay, so you look at the lunch menu because it's usually lower prices. It's smaller portions, but it's usually lower prices. And you say, well, yeah, that looks pretty good, but I don't really see anything that grabs my attention. And then you look at the dinner menu and say, oh, this is much better. Yeah, the prices are higher and the selections, the portions are a little bit larger, but oh, this looks much better. Well, this is kind of like having a managed care plan, Medicare Advantage plan, versus having original Medicare. With the managed care plan, you're basically ordering off of the lunch menu. You don't have as many choices. Well, your portions of health care may or may not be smaller, because you do have an insurance company saying, well, before you go have that test, before you have this procedure, you need to talk to us first. We may not want you to do that. We may want you to either wait or look for a less expensive alternative. So that's kind of like managed care plans, Medicare Advantage plans. It's it looks great because the prices are lower, the premiums that you pay, because most of the Medicare Advantage plans do not have a premium in them. But you may not realize that your selections, your access to health care are somewhat limited. You really need to stay within the lines. If you color outside the lines in a Medicare Advantage plan, you're going to have some whoops surprises, and we'll talk about that in another video, surprise billing. But original Medicare is more like ordering off the dinner menu. Yeah, the prices are a little bit higher in that you do have a premium that you're going to pay for your Medicare supplement plan. G plans currently, and the G plan is the most popular plan among people who are on Medicare. The G plan is currently around $120 a month for somebody turning age 65 in Georgia. This assumes non-tobacco, and male rates are a little bit higher. Female rates might be a little bit lower. So, but that's about what you're looking at. But you have any provider in the country, not just in your back door here, like with a lot of Medicare Advantage plans. They have very tight networks, and if you venture too far from home, you may find yourself in a situation where either the claim isn't covered or it isn't covered completely like you thought it would be. Just think of it like that. If you have trouble really connecting with this term about networks and managed care, Medicare Advantage is like ordering off the lunch menu. Original Medicare and a supplement plan is the dinner menu. Well, you've got a lot more choices, and I think you're going to like it. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.